What we're dealing with here is end-stage arthritis of your hip, which means you've lost all of your space in your hip, which is your cartilage. So you are now rubbing bone on bone. You also have bone spurs, which we also call osteophytes, and those are probably inhibiting your motion. And their really only treatment options at this point are entirely conservative, which would be medications, injections, and therapy, or if the pain is bad enough, if your immobility is bad enough, we move on to having the hip replaced. When we replace a hip, we are replacing the entire hip. So the hip consists of a socket and a ball. What we do is we remove the ball first. We basically route out the socket and place a metal socket in to replace your damaged socket. We also put a plastic piece in that metal socket that actually serves as your new cartilage, so to speak. And then we replace the ball with a number of different components that we can use, and that new metal ball and plastic insert becomes your new hip replacement. The advantage to do a lateral approach is it's a much more extensive approach for patients who have worse anatomy, meaning worse arthritis. We also use it for patients who've had previous hip surgeries, such as hip fractures or hip pinnings and that sort, that possibly have retained metal in their hips, so that we have more access to the hip so that we can remove those components. We also do a lateral hip replacement in patients that are much more stiff and have much more disease than a standard hip replacement would require.